Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching now. Day 15 of Waxvent. I got it right today, guys. Hopefully the door is going to be right as well. But you can see this plug of wax in this patient's here. We've got a couple of patients in this video today. So this first patient here, quite a hard plug. The surface a little bit softened up. We're using the oil. You can see the oil's kind of squidging around the outside edge there. Patients been using a lot of that. But this plug is really firmly wedged on the outer part of the ear canal here. There is a little bit of sort of wet skin underneath, which is what you can see, that lighter material there as we lift this up. That is actually a little bit of skin that's been anchoring this in place. So we're going to get rid of that first of all. There we are. That's the first bit gone. And we'll see if we can get hold of this next section. There we go. So that's the skin gone. So it means now we can concentrate on this plug. Now, sometimes when the wax dries, it can dry around these pieces of skin and they can really hold it in place. So it's a good idea to get rid of those first if you can. And then the plug tends to become a little bit more mobile. You can see me just trying to fight this to get it out the canal. It's a little bit bigger than the ear canal entrance. The ear canal is actually kind of almost folded over slightly. So it means it's a little bit more difficult to get this out. But we're going to get a good grip here with the suction tube. Sometimes if it gets really stuck, we'll go in with a Jobson horn just to bring it out. But this one looks like it's going to come away quite nicely. There we go. Out that pops. Whoop, just got to get around the corner. Give it a bit of a wiggle. Work it around the corner. There we are. Out that comes. So you can see a nice big old plug there. Patient obviously feeling very, very blocked out. We'll take a look behind this now. The eardrum itself is squeaky clean in here. It looks lovely and healthy. Really shiny, pearlescent, exactly the way it should look there. Very, very good. So this is the patient's other ear canal. And you can see a very similar story on this one. You'll notice there's no oil in this side. Now, that's quite common with our patients. When you've got sort of plugs blocking both sides, when you put the oil in, it'll form a sort of seal around the plug, so it'll block any gaps around there. So patients can sometimes feel worse when putting the oil in just for the first couple of days. Well, if you imagine you've got these kind of intermittent hearing issues on both sides, you don't want both ears to be really blocked up. So sometimes patients will oil one and not the other, but it doesn't matter too much because we've just popped some oil in now. You can see this big old plug coming out of this side as well. Quite a hard lump here. Just trying to turn it. You can see I'm just trying to get it out of this little notch just in this particular part of the ear. There we go. Out that comes. There was a lot of dry skin around that one as well. And, oh, it's a little bit blurry. Let's give that a bit of a wipe and go back in. Nah, it's just a bit humid, so pop the suction tube in so you can see. But there we are, eardrum looking lovely and healthy on that side as well. So these are the plugs we removed. So we got, oh, I'm not going to count the straggly bit on there. I'm going to call that 2.5 centimeters, which is going to be about an inch or thereabouts. But they're quite hard as well. They feel like little pebbles, these plugs, especially when wax dries a lot. It really goes tough as old boots. So we'll see now. This is the second patient in our compilation video. This looks a lot, although there's a sheen to it, this actually looks a little bit drier to me. So we're just gonna pop the suction tube on this. Let's see how this feels. Yeah, you can see it's tough. Now, although it looks wet, this is actually a really dry husk of wax and skin here. So you can see these sort of layers of skin coming off the side. I'm just getting the Jobson horn down the side of one there. Those layers are formed together and sort of come around and sort of really form this blockage in here. It looks almost like a little ring at the entrance, but I'd imagine it goes a little bit further in. So as we did before, I'm just trying to get some of this skin away. You can see these kind of layers. This is actually the canal wall skin that's kind of dropped off and dried out here, the surface layer of it. Anyway, let's get behind this with a Jobson horn. There we go. Now it's starting to move. You can see those plates of dry skin coming away there. There we go, look at that. So we've got a really hard surface layer there of skin and this much softer, kind of floppy, fresher skin behind it then, this kind of wetter skin there. That was actually part of the canal wall skin there. You can see where it's actually detached there on the bottom. Let's get a look at that eardrum. There you go, eardrum, ooh, not looking particularly healthy, kind of quite grey in there. So what we'll do, we'll give this ear canal wall here a little, you can see there, sorry, got interrupted. You can see how that skin layer comes off the canal wall there. You can see it lifting from the canal. And that's what formed this plug. So you can, it's really kind of tough old stuff and it stays attached really well to the canal wall. So we're just going to see if we can grip this section. Let's pull this one out. slowly does it. There we go. And that's going to peel that section of canal wall away. There we are. So this is dead skin. So this doesn't hurt the patient coming away. Patient, if anything, would feel a slight pulling sensation, and a lot of the time it's actually a relief when this comes out, because the patient, a lot of the time patients will report this kind of issue feeling really itchy, and that's our body's way of encouraging us to try and scratch that top layer off, because what you get is the dry layer and the fresh skin layer underneath are passing back and forth over one another all the time, and that's what can cause this issue. This patient here, I remember now this one, this patient's actually had what they call laryngoplasty, which is basically a repaired eardrum. So what you could see there, it looked scarred, it looked abnormal, if you like, but that's just the scar tissue left behind from where they've actually patched up that eardrum and fixed a perforated eardrum in there. But this is the skin plate that comes away. That's the other thing we talk about with these. When you, a lot of the time, if you've had surgery on your ears, it's not uncommon to get these kind of skin issues, because it can interrupt the natural migration process of the skin coming out the ear canal. So you'll get these kind of detachments and things like that going on. Okay, this is the last patient in this compilation, I think, and this is a very, very soft wax. Look at this. It's really squishy. So we've gone from sort of hard plugs, hard skin, now we've gone to the softer end of the scale now for this one. So it's all around the outside edge, really, really sticky. You'll see a little bit of skin there. As we lift this up, that whiter layer underneath is the canal wall skin coming away as well. So you've had a few canal wall skin detachments in this one, but all coming away very nicely here. Just maneuvering this outer plug. There we go, it's coming away. Oh, one thing somebody did put in the comments of the video yesterday, which I thought was a really good point, if I've got enough time to talk to you about it. When I leave bits behind in the ear, I always say, like, oh, these will just migrate out. And somebody put in the comments said, well, why didn't that happen in the first place for you to be able to do this? Which I think is a really good question. A lot of the time, when patients have issues like this, there can be problems with either sort of an anatomical issue, which is causing the problem with the wax buildup, or it can just be that, you know, we don't produce quite as much oil in our ear canals as we get a little bit older, and the wax becomes drier and stickier. So it does tend to sort of plug up sometimes with patients. The reason that I would say it's going to migrate moving forward is because I give them some advice about maintenance on their ear. So what we'd say is pop a little bit of olive oil in on a regular basis. Sorry, big plug coming away there. A little bit of olive oil in on a regular basis. So we're giving them advice about how to maintain that ear health a little bit more effectively then. And that way then those pieces will then migrate out, because we've given them the right advice as to how to keep those ears nice and clean. And usually we're telling them not to use Q-tips as well. So that's why we would say it would migrate out past that point. And when you get the big old plugs out as well, it just means it's a lot easier for the rest of it to come out. So lovely looking eardrum on that side. I'm just going to do a little bit of tidy up, get these couple of bits and bobs off the outside edge here. There we are. Oh, thank you so much for Stephen as well, who's doing an amazing job with the wax layer expressive. He sent me a bit of a Herculean task this year, because we had 24 videos. Well, guys, with that last patient there, everything got sucked inside the tank. And I don't know, you guys don't really like a tank shot this close to Christmas, when there's so many lovely foods around. I really didn't want to do that one to you. So guys, thank you so much for watching our Waxfit video today. Stay tuned tomorrow, and I think you may see Taylor tomorrow, or hear Taylor, one of the two. So stay tuned for Taylor tomorrow, and I think we're going to take it in turns then all the way up until Christmas Eve, guys. I've got a slightly longer video. I've put, oh, I'm not going to spoil it. Stay tuned for Christmas Eve. As always, guys, take care of your ears, take care of yourselves, and take care of one another, and I'll see you tomorrow. Bye-bye. Oh no, Taylor will see you tomorrow. I'll see you the day after. Bye-bye.